Hello and welcome back. We're going to take a look now at basics of Medicare. Most of you have seen a card like this. If you haven't, that's probably because you're not yet age 65 and haven't received it. If you are nearing age 65, about 90 days prior to your 65th birthday, you should reach out to your local Social Security office and set an appointment with them to get this card issued for you. If you're already accepting Social Security benefits, meaning getting checks in the mail, you will automatically be enrolled in Medicare and receive this card 90 to 120 days prior to the month in which you turn age 65. This card is very, very important, and you must have your Medicare issued to you to be able to enroll in any other Medicare plans. The card is going to have your name, your Medicare claim number, which is usually based off of your Social Security number, followed by a letter. It might also be based on a spouse's or a deceased spouse Social Security number. Also very important on that card are your Part A and Part B of Medicare effective dates. Part A is for hospital. Part B is for medical, such as going to see your family physician or any outpatient procedures. Let's talk a little bit then about the different types of Medicare plans. One of the very most common is called a Medicare supplement, more commonly known as a Medigap plan. We think it's more easy and more descriptive to say Medigap, so that's what we will call them. The reason for that is that a Medigap plan fills in the financial gaps in original Medicare Part A and Part B, meaning it helps to pay the difference between the 80% that Medicare would normally cover and what your doctor or your hospital are charging. Now, Medigap plans do not include prescription drugs. That was separated by Medicare several years ago, and that's for your benefit so that you can choose the best medical plan and then combine with it the best Part D or prescription drug plan. If you hear those two terms, they are synonymous. It's a Part B or prescription drug plan for Medicare. It's going to supplement your medical so that you can go to your local pharmacy and get the prescriptions that you need to take. Now, one caveat is that if you do enroll in a Medigap plan, you will need to pay your first month's premium when you enroll, so please do be ready for that. That's not the idea of your former employer or of Extend Health. That is the rule from those Medigap carriers or insurance companies. That does not, though, apply to enrollment in the Part D drug plan. The other option, or the other basic type of Medicare insurance, is called a Medicare Advantage plan. You'll also see it called an MAPD. That stands for Medicare Advantage Prescription Drug. Most of these plans do include prescription drugs as part of the plan. For the most part, these are going to be lower premium plans, but you will have a copay if you go to see a doctor or go to the hospital. With the plan we were looking at just a moment ago, the Medigap plan, most of those do not have a copay for receiving medical care. Again, these will include your prescription drugs as part of the plan, and it will be all together. Now, Medicare Advantage plans take over the management of your global health care. So they are going to step in front of your original Medicare Part A and B. You never lose your Medicare Part A and B, but they somewhat fade into the background with a Medicare Advantage plan, and this would all be managed by the company that you choose in a Medicare Advantage plan. These work extremely well for many, many retirees, and so you'll certainly want to explore that option. Let's talk a little bit more about RX or Part D prescription drug plans. Again, it's called Part D as part of Medicare, very commonly called just a prescription drug plan. They are standardized benefits that follow Medicare guidelines. The companies that offer these are private insurance companies, but they're contracted with Medicare and must follow very closely their regulations and guidelines. All of these plans are going to have co-pays at some levels. Some of them will have a deductible before they pay anything. Others will not have a deductible. So we're going to want to explore with you what's going to be the best value for you based on the prescription drugs that you do take. Also keeping in mind that this is insurance. We're buying insurance because of the what if. What if I do come down with another disease or a catastrophic illness? And we certainly hope not, but we're buying insurance and we must insure ourselves for that possibility. Most of the prescription drug plans do have mail order discounts for getting a 90-day supply at one time. And I know many of you are already doing 90-day supplies, and so this could continue that for you. Let's talk then about Medicare prescription drug coverage a bit more. This is going to talk about something that you've heard as the donut hole. There are several phases to Medicare drug coverage. The initial coverage phase is where you would pay deductible if there is one on your plan, and then the co-pays for your prescription drugs. That coverage goes up to the first $2,930 in actual costs of medications. Actual costs of medications. If you're paying a $4 or even a $10 copay or even a $35 copay for a prescription drug, that's not really the true retail cost of that medication. It's going to be much higher. So the way that this is calculated is we're looking at the actual or retail cost of that drug. If you've paid $4 and the drug really costs $25, the calculation will be based on $25. When you reach that $2,930 in actual costs of medications, you would enter into a phase commonly known as the donut hole. A more proper name for it is the coverage gap. During the coverage gap, you would pay 50% of the retail cost of any brand name drugs. And then for generic drugs, you would pay 86% of the cost of those lower cost drugs. That phase or coverage area would last until you reached out-of-pocket costs of $4,700. Now, the good news about this is statistically only about 1 in 4 of you would ever reach the donut hole area. Then there is one more phase of coverage. If you do reach that $4,700 in actual out-of-pocket costs, at that point you would enter into the last phase of coverage called catastrophic coverage. At that point you would have greatly reduced co-pays for generic drugs and for brand name drugs. The Medicare rules surrounding that are $2.60 for a generic prescription for a 30-day supply, or $6.50 for a brand name 30-day supply, or, and this is more important, or 5% of the actual retail cost of the drug, whichever is greater. In most cases, if it's a brand name drug, let's just use an easy example of $200 actual cost of that drug, then you're going to pay 5% or $10 for that drug. And that would continue for the rest of that calendar year. At that point, then it would reset and you would go back to initial coverage for the upcoming year. We want to assure you that we are here to help you. That's really our mission. Everyone has different medical and prescription drug needs, and your benefit advisor is just waiting to help you to determine which of the many, many choices that we offer at Extend Health will best fit your needs. And that may change from year to year. We'll be here in the future to discuss that with you as well. So please do reach out to your benefit advisor. It's just a simple phone call. They're there to help you and to discuss, to find what's going to be the best coverage for you individually.